Right, hello everyone. Good evening. Thank you so much for joining us for the Know Your Worth Salary Insight and Contract Pitfall webinar with Resolve. I want to take a couple minutes just to give everybody time to log in. I'll start by introducing myself. I'm Lainey Bargan. I am the Events Communications Specialist here at Practice Match. If you've attended any of our in-person career fairs or visited our booth at any physician conferences, you may have already met me. Practice Match is a nationwide job board, and we also have free career resources online to help aid in your career journey, such as webinars like these, CV builder and reviews, career fairs, and scholarship opportunities, as well as so much more. So make sure to go to our website to check that out for more information. I do also want to remind everyone that this webinar is being recorded and all microphones have been muted and cameras turned off for the duration of the event. Please put all questions in the Q&A chat box and we will answer it as the webinar is going on. We will also send you all a link to this recording by the end of the week. And it looks like we have a good amount of attendees already here. So if you're ready, feel free to take it away.
Awesome. Well, thank you so much, Lainey. Hi, everyone. Good evening. My name is Samip Kadakia, and really happy to be here with you today. And thanks again for your time this evening. I currently practice as a head and neck surgical oncologist and reconstructive plastic surgeon in Dayton, Ohio. And probably about a year ago, I got really interested in working with Resolve as I had them assist me with my own contract negotiations. And I think when I was around that time, I got interested in getting an idea of how we can maximize as physicians, not just what we are being compensated, but even the whole package, right? I know that from the time when I was a resident to a fellow to an attending, and again, many years into being an attending, that there are so many things that you simply don't know. And the more time that passes, again, oftentimes it feels like there's only more questions that come up. So I think having had a great experience with Resolve, I really wanted to get involved to get an idea of, can we pass on this education to other physicians who are in practice, folks who are looking to make changes, or even residents who are looking to take that next step? So in any case, the next hour that we'll spend together, I'll focus probably about 20 to 25 minutes on a brief slideshow that we've put together. A lot of this is meant to be interactive, so I'll go through some information, some brief data, some information about what our firm does, but mostly I'm happy to have it be an open forum where if there's a certain topic or a certain part of the discussion that anybody wants to focus on, again, feel free to shoot it in the Q&A or even raise your hand and I can call on you and we can discuss whatever question you have. So, like I said, I work with Resolve, and I know that many of you may have been part of these seminars in the past. But what Resolve does is it basically is a firm that specializes in physician contracts, and currently it's probably the largest and maybe even the most known firm, even if you were to Google it. And what it basically does is when you work with Resolve, they have a large engine. Part of it's AI driven, part of it is human driven, but essentially they have collected data from a number of different sources. Some of them are surveys, some of them are physicians that they've worked with, some of it is market data, and essentially have provided all this information online, which is readily available to folks who have worked with them. And based on this information, the thought is, how can it provide guidance to people looking for contract analyses? And sometimes it can be as straightforward as you have access to this information online, and that gives you all the information you need to talk to your employer or your HR team. In other situations, it may be something where you say, listen, I really want to speak directly with an attorney with the team and see if they can independently review my contract, help redline it, maybe even advise me. And there are times where they may say, listen, it may be better for you to take that information back to your own team, or if you need, they can even advocate on your behalf. So again, suffice it to say that I think it's a very comprehensive module that's provided online. So this brings me to the next slide, and it's hard to have a contract discussion or even get people interested without getting an idea of what's the value of even considering a contract negotiation, right? What is a non-compete worth? What is it worth if you are paid 10% less than your colleague? What is it worth if you're paid 10% more? So this is a figure, again, what's worth about $3.5 million? And keep this number in mind as we're going to get to it a little bit later. So, whenever you're looking to either make a change in your current occupation or you're looking for your first occupation, and this applies to physicians, to advanced providers, et cetera, this is a nice schematic that shows that it's difficult to have it all. If you want to have a number of guarantees in your contract, hey, you want to have great compensation and you want to have lots of vacation time and you want to have this, that, and the other, it's sometimes difficult to have that plus have all the autonomy that you would in, say, a private practice. So this chart basically shows that depending on what situation you're in, you're going to either have to make some concessions or say, listen, what is a good blend of the two? Oftentimes, when you're in an employed setting, when you're in academics, or maybe in a privatized healthcare system, there may be more guarantees. And again, many folks like to join larger practices or larger systems because of those guarantees. But the trade-off may be that maybe you're not the main decision maker for everything. As physicians and as advanced providers, we of course like to be in charge of our patient decisions. We like to have control over as much as we can. But working in a large system, you oftentimes have to go through multiple layers before decisions can be made, especially if they're logistic decisions, practice decisions, or really anything that's beyond your clinical acumen. On the other hand, if you're in a private practice model, you might find that, you know what, maybe more things are a little bit volatile. Maybe things aren't as predictable. But on the other hand, you get to call the shots. So this schematic just represents that it's difficult to have everything. But if you get an idea of, okay, well, what is a good middle point for you that you would be happy with, then it's easy to progress from there. So whenever you look at contracts, one of the things that are difficult to delineate from a contract, and again, I imagine everybody in the audience, some folks may already be in practice, some may be looking to make a change because they've been in practice for 15 years, 20 years, whatever it is. My personal experience has been that whenever I've looked at contracts year in and year out, it has been difficult to delineate exactly where the red tape is, right? So whenever you look at the risks that come in a contract, some of the things may be outlined where they say, okay, well, here is a non-compete. Here is what our tail coverage is. Is there a cap in your contract? Has anybody told you that, okay, you won't get paid beyond this even if you overwork this? I've had some folks come up and say, you know what, they had situations where maybe they weren't aware of a cap. Maybe it was time to get bonus, or maybe it was time to collect call pay. And then they were eventually told that, hey, listen, you already met that X percentile. You simply can't be paid beyond that. I know people that have expressed frustration in the past because of that as well. But again, those are all risks that aren't always spelled out. On the other hand, when you look at the work that all of us do as patient care providers, there's a lot of unspoken risk, right? There are risks that are there in terms of our time cost, whatever cost there is to our family, our health, mental health. There may be risks that come in the form of how much you're doing. Is there a burnout risk? Is any of that risk coming home with you to other parts of your life, right? So those are all the unspoken risks that may exist too. But suffice it to say that whenever you sign up for that contract, all of those things are essentially bundled in and it's assumed that you're aware of them. And I think one of the things that we can assist with is helping break down those assumptions so that way you go into these negotiations the most prepared and the most knowledgeable to make the best decision for yourself. So previously we had talked about the non-compete, and this is just an example slide, but not too long ago, there was a point where the FTC, the Federal Trade Commission, had said, well, you know what, maybe these non-competes aren't a great idea. And some people were actually able to take advantage of that. But recently that has been overturned. And I think what's being found is that, okay, well, the non-competes that were previously put into contracts are still truly seen as non-competes. The reason this is important is that depending on where you practice, you may be practicing in a very busy city. Maybe you're practicing somewhere rural. Maybe you're practicing in a state where, hey, there's a hospital every 15 minutes, right? So depending on what that looks like, and oftentimes when people first sign their contract, the non-compete is something that is known about, but most people don't go into a new job thinking that they're going to be switching careers or that something adverse could happen. But when and if that type of thing happens, then the non-compete becomes really important. What does that mean for you? Does that mean that if you're unable to work at your current practice or hospital, does that mean that you and your family will have to move to another state? Does it mean that you will have to commute and find something that's an hour away, 2 hours away? So again, the non-compete is something that is very, very important to know about. And if you look at the figures over here, depending on how often physicians change careers or what that all comes with, it could be a substantial cost in the order of millions over the course of your career. So the next part I bring up is when you look at the compensation itself. So oftentimes compensation can be just a base salary. The compensation may be base salary plus a bonus incentive. What does the base salary entail? What does the bonus entail? Is it a collection system? Is it an RVU system? Is it a cap that includes everything? Is call pay included? Are administrative stipends included? So the reason I put this up is that, again, a lot of these things can also be nebulous and you'd rather know upfront than know afterwards. And one of the other tools that we offer is having all the data that we do, giving an idea of what are the average pay scales for different specialties, what does it look like in different parts of the country. If you are living in New York City and you're getting paid X, what can you reasonably expect if you were to move to, say, Alabama next year? Those are all points of data that we can provide to you for that next negotiation. So going back to compensation, when you look at this slide, this gives an idea of just how variable compensation can be and just how many different things can be a part of it. The reason this is important is that there are many unsaid things that are part of compensation depending on what your contract may say. And I'd like to draw attention to when you look at the upper left, they talk about relocation, they talk about signing bonuses. My personal experience was that I previously, when I had signed my initial contracts, I wasn't as aware that signing bonuses were not really bonuses. I wasn't really aware that retention bonuses weren't really bonuses. Um, for many folks, signing bonuses and retention bonuses effectively are loans that gradually pay themselves off, right? But it always feels good to get a big chunk of cash when you sign your contract. But what you don't always know is that it may be amortized. To give an example, there was a contract that we reviewed not too long ago where a resident was being offered 100,000 for, I think it was an educational loan payment. That individual was happy and thought that, hey, this is basically a freebie that they're throwing me so that way I can come here. I'm really interested. But say, sometime later, they then found out that, hey, actually the fine print says that this is amortized over 5 years. So essentially, every year 20,000 of this is basically forgiven, but it is included in that total compensation. So if you happen to be in a situation where, say, you've had a great year, you're a proceduralist, you've overperformed, and you may have exceeded that 90th percentile or 95th or whatever your hospital's top percentile is, if you're not taking into account that, hey, that educational stipend was included in this, this retention bonus was included, this relocation was included, all those things add up to that top roof of compensation. And once you get there, then maybe all of a sudden, if you're expecting that, hey, this year I'm going to be getting a 25,000 bonus, a 50,000 bonus, whatever it is, but wait a second, if you haven't taken into account that maybe that was already kind of paid to you in these different buckets, you may not be seeing that bonus, right? So that's another important piece of education that, again, personally I've experienced, but many other folks that I've worked with have also experienced. Any questions so far, by the way? All right, then I'll keep going. So this slide again reiterates some of the previous points that I made about how when you look at compensation models, there are many different options. If you are in, say, a private practice setting, you may be on a collection system. Typically, private practices that are not necessarily hospital affiliated won't be on RVU scales. They may be on a collection scale. Maybe they offer you a base salary, and then they say, listen, we're going to be tracking your collections over the course of a year. And once we can subtract whatever your overhead is, that will then factor into your bonus. But what does this look like if there is a tiered bonus? What does it look like if that practice happens to have very high overhead? Those are all important factors to consider. On the other hand, if you are in a hospital system in academics and you're being paid on an RVU scale, the questions may arise as to is there a certain number of RVUs that I need to make in order to earn my salary, so to speak? Is there a certain number of RVUs that I need to uh, generate in order to be in bonus range? What is the dollar per RVU that I'm being given? Is that a stagnant number? Does that change depending on the percentile that I'm producing at? Again, these are all things that are not the same amongst all contracts. I have worked with some physicians also that have mentioned that their hospital systems even change RVU payouts based on call. If they agree to taking, say, 5 days of trauma call a month, then maybe their RVU, their dollar per RVU, maybe that increases by about $5 or $10, whatever it may be. So the reason I bring this up is that it's very important to kind of get into the nitty-gritty about how you are paid exactly, how your bonus is going to be calculated, and if there are going to be any subtractions based on overhead. This slide just shows that there's a variety of data points that are available. If you sign up for MGMA or AMGA, that's all available too. I believe those are all paid surveys. On our website, all of the conglomerated data is available to you. And then, of course, whenever you are talking with your employers, they typically have information they can give you regarding what the main averages are, what the trends are in your field, especially in that area. Again, if they would like to be competitive. So as we close out the presentation, the reason I flashed this up is that most folks will get a factory standard contract. A lot of larger systems don't like to change the contract per provider. They may say, listen, hey, you're a cardiologist. We have a standard cardiology contract. You are a hospitalist. Maybe there is a standard hospitalist contract. Most people, and about 85%, usually try to make some kind of an amendment in their contract. It may be something where they talk to their employer to ask for more vacation time. Maybe they're asking for a change in the non-compete. Maybe they're asking for a change in the term of the contract or the compensation. But the point is that most physicians tend to want to go back to their employer to ask for something different. And that's where it's important to go in armed with the right knowledge, because the number I flashed up before, this number is astounding and basically shows that if you aren't in a position where you're getting paid your fair market value, if you are getting underpaid, so to speak, if you're in a situation where maybe you could have pushed for more, but maybe you didn't know to push for more, or maybe you look back after a few years and you realize that, hey, you ended up doing a lot of pro bono work that the hospital wasn't able to compensate you for because the contract either wasn't aligned or maybe you didn't have the tools to go into that discussion. You could be potentially losing or leaving $3.5 million on the table. It could even be more depending on what your field is or what discipline you work in. So the reason I mentioned that is that those are all things that, of course, are available online. Our firm certainly offers those things, and we'd be happy to work with you. But there's a lot of information that's available even through different agencies where you can go in empowered to make that best decision. And as a physician, I myself have been in practice for about 10 years or so. I have found that that negotiation and that discussion not only allows you to command what your value is, and it also allows you to be happy in your career and also have a sustainable long career as well. So with that, I'll conclude the presentation. Like I said, I kept it brief, about 15, 20 minutes. The remainder of this time, if anybody has any questions, if anybody else wants to discuss anything that was pertinent to that, I'm happy to go through anything additional. Yes, I see a hand from Hakeem. Hey, Hakeem, go ahead, please.
Hello, Dr. Kurd. Thank you so much for your presentation. Actually, I'm an emergency physician. How to navigate the non-compete contracts, especially if you're with a bigger healthcare system and you are a research scholar and on a waiver visa. There are certain restrictions when you go for a waiver visa contracts. Um, and if you're a research scholar, if I don't know how much support you will get from the healthcare system, so you have to go for the other institutions or anything. So how to navigate in this?
Uh, Sorry, can you rephrase the question? I don't think I understood the question fully.
So as a behavior physician, driven behavior physician, working in a particular um, city or in a particular status where the behavior position is, um, going into a non-compete system makes you like work in only one system, especially if you're a emergency physician, you can do only 12 shifts. You cannot work more,
Mhm.
or we cannot travel anywhere else to work. And I'm a research scholar. How does this will help us to negotiate the contract for non-compete and to have the research benefits from other institutions?
Oh, I see. So what you're saying is that based on that situation, and what you're saying is that as an ER physician, because you have limited number of shifts and you have other obligations, you would essentially like to have ways that you potentially could work at other systems also for additional income. Is that correct?
Yeah, or at least you want to be like, say, about I'm a global health research
Hmm. Hmm.
collaborative ambassador and I do research with other institutions.
Hmm.
How can I get this in my contract?
Oh, I see. Okay. Yeah, and that's a great example of, I think, what you can try to negotiate. One of the things that our company does, and again, we always advise that if you're able to have that discussion first with your employer, it's always better because if it's something where you talk with them and you say, listen, I understand that I'm providing the service, and of course I don't want to do anything that would be counter to that, but you also have other things that you're interested in that you're already doing, or like you said, if the hospital doesn't offer you additional opportunities and you've found them, I think it's important to advocate for that. In some scenarios, they may be understanding of that and they may be able to add certain things into the contract. But again, if there are times where you feel like that discussion is not going as productively, what our organization does is if you have a contract that they've sent you, oftentimes we can analyze it, we can compare it with other data that's available, and make suggestions for how the language can potentially be changed. Typically, once we give that back, you're able to send that back to your employer and see if they're able to meet you halfway or make any changes. In other situations, there are times where we can even get involved, or rather the attorneys at Resolve can get involved and do some of that advocacy for you.
Thank you so much.
All right, we have a couple of questions in the QA box. So the first one is, can you explain RVUs?
Yeah, absolutely. Um, so RVU is relative value unit. And what it basically means is if you're a proceduralist or a surgeon, it is a leveled way to measure productivity. So, for example, um, I do head and neck oncology and reconstructive surgery. So, and again, I'm just going to make up this number, but if I do say some kind of a flap reconstruction on a patient after they have Mohs surgery, maybe there's a certain code that I bill, maybe it's a tissue rearrangement or something, and let's say that that is worth 5 RVUs or 10 RVUs. What that basically means is that regardless of the patient's insurance, regardless of what the hospital is collecting, regardless of what the billing is, because I have performed that work, they have measured my productivity by this essentially arbitrary number, which it's not 100% arbitrary. It is dependent on the complexity of the work that you do. And the RVU typically is supposed to be a conglomerate of work that is not just done in the operating room, or if you're, say, a GI physician in the endo suite, it's supposed to include the work that goes into the postoperative care as well. So suffice it to say that it becomes a very level playing ground where if you are someone that works at a inner city hospital versus someone who works at a hospital that is in a very well insured posh area, for example, you may have very different payer demographics, right? But again, the value that you're providing is the same. The procedure that you're performing is the same. So having an RVU levels that playing field, and also it makes the tracking of your productivity very easy. And to go one step further, some contracts, they may have a model where there's a base salary and they say, you know what, Dr. So-and-so, we're going to pay you $100,000 for the year. But if you do X number of RVUs, then you know what, maybe we'll give you a bonus where we'll pay you this many dollars per RVU. So does that make sense as far as the RVU component?
All right. The next question is, when met with this is our standard contract, how often are larger organizations able to amend the contract?
I think that depends on the organization. Most times they are able to, but I would say that it probably depends from location to location. There are some facilities that opt to not make any changes, and I imagine if there are facilities where they have a plethora of applications and many physicians that are wanting to work there, they probably don't have as much of an impetus to make changes. In either smaller hospital systems or maybe hospital systems where they are truly looking for physicians or they are wanting to add a certain service line, I imagine they would be more open to making those changes.
Right. The next question is, what is the risk of us losing the job offer with negotiations? Is there any safety net Resolve provides? Some jobs do not like negotiators.
That's a great point too. Um, I can't speak exactly to any safeguards that Resolve provides, but what I would say is that with any negotiation, I mean, it's true that some employers may not necessarily like negotiating, but I think that also raises a question in terms of what that employer, what that administration may look like. I think as long as the negotiations are done in a professional manner, at the end of the day, I mean, you're basically asking for something that you would like to have in order to make this a fulfilling and sustainable career for you. Um, Generally, you may not get every single thing that you ask for. If you land somewhere in the middle, or if you're able to gain something, relatively successful negotiation. But that being said, I don't think there's really any safeguard, and there's no way to prevent them from being upset. My From my personal experience, and I think from what we've worked with clients, is that you always want to have a good relationship. Never approach negotiations in an adversarial way. There's very few times where you really need to be so staunch about things, but it is important to go into a negotiation or really review a contract and have an idea personally of what you're willing to concede, what you're not willing to concede. And a lot of the advice that I've given colleagues is know what your non-negotiables are, right? If you have some part of your contract where you say, listen, I absolutely have to have 6 weeks of vacation. I can't concede that. It doesn't matter if I get paid less, then that's going to be your metric, right? If that's something that you can't obtain or they can't give you, then maybe you know that that may not be the best place for you. Um, I'm not sure if that fully answers your question, but I think it is a little bit of a softer answer, and I think a lot of it does hinge on the relationship and the interaction between you and your employer.
The next question is for academic institutions, when is it a good time to ask for the actual salary? Should I wait until the offer letter?
Great question. Also don't have an exact answer for that because I don't think there is a template of when the right time is. Um, I think as a general rule of thumb, I think once you express interest and I think once you get to the point of interviewing, then I think it's reasonably accepted decorum, I think, to begin asking those questions. I think when there is a consideration of an offer, I think if it's something where if it's going to be a deal breaker, or if it's something where, listen, it's hard for you to come to an interview at a place so far, or it's going to require a lot of sacrifice, then I think once you get a little bit further in the discussion, you could ask those questions in probably maybe less of a direct way. You could say, listen, what is the numeration component here? Um, what are the trends in terms of how people are compensated? I mean, those are questions that you can ask, but my general recommendation is you don't want to ask that too early on because you never want an employer to think that that is your main focus. Generally, I think you want to show them that you are looking for a sustainable career, that you're interested in providing an excellent service, you're there to provide value. And I think once the discussion progresses, then it becomes a little bit easier and a better time to go into the specifics of that.
All right. The next one is I recently decided against an academic position when I reviewed the official contract. These parts seem really odd to me, and I really checked with several physician friends and one attorney friend. Can an employer even state you have to pay back salary you would have earned if you stay the full 3-year contract you had stayed? Have not seen such a contract ever. Usually it only requires repayment of prorated amount of any sign-on you may have taken, and most do not even require you to pay back reallocation allowance, especially if you've worked at least 1 to 2 years.
Okay. That question, I think, may be better to answer after an analysis is done, only because I think a lot of it depends on what's written in the contract and what the lingo is. So I think I probably won't answer that question in this forum right now.
Okay. The next one is, as someone who is planning on taking a year after graduation in community practice before pursuing fellowship the year after, how should I approach seeking out job opportunities in dermatology for that year, and what are some red flags I should look for in contracts that may come my way?
So you're asking for how to pursue a dermatology career in between residency and fellowship or after fellowship?
It seems like just the year in between.
The year in between. Okay. Eh, If it's the year in between, I think that the challenge is that it's difficult to look for red flags in the sense that if you're going to be looking for somewhere to be employed for just a year, then I think the employer may have a little bit of the upper hand in that sense, only because if you're giving them a very short amount of time of service, and if there's not really a commitment that you're going to come back to them, it may be difficult to make a lot of requests.
All right, those are all the questions we have at the moment. If anyone has any more questions, feel free to put them in the QA box and we will try to answer it before we end this presentation. I'll give a couple more minutes just to see if anyone has any more questions. All right, we do have one more. Would you still advise hiring a lawyer for reviewing the contract if working with Resolve?
So Resolve actually has a team of attorneys that are part of the actual process. You're asking if basically if an attorney is necessary outside of Resolve. Am I understanding that correctly?
I believe so.
Okay. Yeah, Resolve actually includes a number of educators, support staff, and it's run by attorneys. So basically, if you use Resolve services, then you're going to have access to attorneys to help you out.
All right, it looks like that is most of the questions we have in the QA chat. Um, so at this time, I want to thank everyone for joining us this evening. Oh, wait, looks like we have a couple more. Okay. What is the typical timeline in terms of months required in negotiating? Likely, or like how early should you start the negotiation process?
Do you mean from the time that you get the offer?
I'm not sure. It sounds, or they just asked the typical timeline in terms of months required in negotiating.
I see. Okay, so if I'm understanding it correctly, so when you get an offer letter, or sometimes they may give you a memorandum of understanding, um, from that point forward, you can probably begin getting either an attorney involved if you choose to, or the negotiation process. Um, from when they extend the contract, and again, every institution is different. A lot of it will depend on how quickly they can get back to you and how quickly you're able to get back to them with information. I do think that from what I've heard from colleagues and from experience, it's usually a few month process, but it does depend on how quickly things progress. If you ask for a small change and if they're able to make it, then maybe that negotiation is only a few weeks long. Um, Generally, I haven't seen it be on the order of days. It's usually, I'd say, a few weeks here and there. But again, if you're asking for more information or things that I think require more research or even market information, then it could be a few months.
Right. And then one more is some employers offer stipends during residency. Does this catchy?
Does this catch?
Yeah.
Okay. Yeah, that I don't know too much information specifically about that, but I do know that there are employers that are able to offer certain packages sort of as a in return for that commitment that you're going to be joining them. I don't know the details of what those look like or what's considered standard for those, but I am aware that they exist.
All right. And then one more. If there is a fellowship in the institution and one like to do, can this be discussed in contract?
You're saying that if there's a fellowship offered at a place where you'd like to work, can you try to bargain into the fellowship, you're saying, as a part of the contract to work there?
Yes, I believe so.
Okay. My understanding is that that probably wouldn't work, only because a lot of the fellowship, I think, applications and fellowship training is based on matches, credentials, I think aptitude and things like that too. So my understanding is that that could be perceived as a conflict of interest. So I'm not aware of an arrangement like that. The other way could be possible where if someone is going to um, join an institution for training, and if it so happens that they like it, that it may give them a step in the door to potentially work there. But I don't think they would offer a training spot because you were going to, or rather, it would be difficult to sign a contract to work somewhere and then use that as a way to also get training there, I think.
There's a question that says, just to clarify, none of my physician friends think any of us have ever encountered a contract that states you have to pay back salary you have not earned, that you would have to earn, that you would have earned should you stay to the end of your 3-year contract. The basis of this question is we wonder if it is even legal to ask a doctor to pay back money you have not earned.
This may be a question that I would direct towards one of the attorneys, to be honest. I think it would probably require more of a review of that particular situation, so I don't think I'd be able to properly answer that question.
All right. I believe that is all of the questions that we do have for you at the moment. I'd like to thank everyone for joining us this evening. I also want to let everyone know that we do have another webinar with Resolve on June 3rd. So if you have any more questions that come up between now and then, feel free to join us for that one as well. Until then, this was recorded and you will get a copy of this recording link sent to the email you registered for this webinar with. We thank you so much for your time and we appreciate Resolve and Dr. Katikia joining us today. Thank you so much and have a great rest of your evening.
Thanks, everyone.